Thank you both, Allison and Mona, for these informative presentations. I'm sure everyone really appreciated the information you brought today. Um, it looks like we do have a few minutes to get to a couple of questions. So before we get started with the questions, I just encourage all the participants to type in your questions in the Q&A function. As Allison mentioned earlier, if we don't get to those questions during the session, they will be answered and answers will be posted on the Summit's website. So to get us started, I know earlier on in the presentation, Mona mentioned testing for undocumented immigrants. So with that said, I'm wondering if you all have any thoughts around whether public charge will be an issue that will come up around folks who are trying to access COVID-19 testing and treatment. So open it up for either of you to respond to that, and I'm happy to chime in as well.
Thank you. So for those of you who aren't aware, public charge is a regulation that went into effect that takes into consideration when someone is seeking, oops, we good? Okay, all right. When someone is seeking legal status in the United States, whether or not they were using certain public programs. And it's caused a lot of controversy and angst because even though it's been a long-standing rule, this current administration has significantly increased what it means to be considered a public charge. And the good news is, according to the state of California, is if you are an immigrant, undocumented or documented, and if you do become part of that new presumptive eligibility group for COVID-19 testing or treatment under Medi-Cal, that does not count towards the public charge rule. Before we post these slides publicly, we will add a link to the additional resources pages that directs you to more information. And Aurora, certainly working with the community health centers, you probably have more direct knowledge of this, so feel free to add anything else you want to share as it relates to public charge.
Thank you, Mona, for that. And again, at the Coalition OC, we have done some work around public charge just to make sure that the community has the information they need to know what benefits they should be accessing. And so just two things that I really want to emphasize is, again, we don't want folks to feel limited from seeking treatment and testing for COVID-19 because of their immigration status. So we encourage you all to really encourage families to get the support that they need and that it won't be a risk to them. And the second point that I wanted to make to that was we are involved with the Protecting Immigrant Families Coalition that has a lot of really helpful resources to help folks understand what public charge is. They also have on there some information about COVID-19. So if folks are interested in learning more about that, please visit protectingimmigrantfamilies.org, and I'll make sure to type this into the chat as well to get more information. So thank you both. For another question is, Mona, you talked about telehealth. Well, actually, both of you talked about telehealth. So we want to know, why is telehealth so important? Not just during the pandemic, but pre and post the pandemic. Why should we all be paying attention to what's happening around telehealth, and why is this so helpful to making sure that our communities are able to access the care they need?
That's a great question. Thank you, Aurora. The early feedback from the expanded use of telehealth has been incredibly positive. Some of the social determinants that can really influence health outcomes and even access to health are barriers like whether somebody has access to childcare, whether somebody has access to transportation, whether somebody can make it to the doctor's office during regular working hours, or if they can only, maybe they're working several jobs and they can only get to the doctor's office or a clinic during off business hours or on the weekends. So especially during a pandemic when we're all supposed to be sheltering in place or working an essential job, it's even harder and riskier to be out in public or going into a medical site can be very frightening. So making so many different types of services and consultations available by telehealth vastly expands access to healthcare while also mitigating the risk associated with receiving healthcare in person. Hospitals and clinics are trying their best to minimize the risk of spread. They don't want to become transmission sites, and they've taken great steps to segregate COVID from non-COVID patients. So anything we can do to minimize the number of bodies walking into a clinic or a hospital or private medical office setting is going to go a long way to limiting the spread of COVID-19. So it's really primarily an equity issue. We are vastly facilitating broader access to care by utilizing telehealth, while also, in terms of the pandemic itself, mitigating the risk.
Thank you, Allison. I really appreciate that. And I know from the Coalition OC's perspective, working with community health centers, that's also really important, as community health centers have been financially impacted by COVID-19 pandemic, and the ability to still be able to provide services via telehealth has really been helpful. I'm not sure if Mona, you wanted to chime in as well.
Actually, Allison, I think, covered the main kind of broader policy goals that we're trying to achieve with telehealth, but thank you.
I would like to add one comment, since I did point out that this is an equity issue. On the flip side, a number of communities do not have access to telehealth. They don't have the technology. They're not familiar with how to use it. There could be language barriers. So I think any forward-looking policy work to be done around expansion of telehealth also has to address these underlying issues as well. So I think the long-term goal and benefits we're already starting to realize right now in this COVID-19 emergency. But as we look forward to how to make this a permanent option for providers and their patients, we have to be sure that we address the underlying technological access issues. Thank you.
Thank you, Allison. Yeah, I definitely agree with that. As folks who are out there doing outreach and education work, I think that's something we need to think about too, right? It is a cultural shift to shift from getting in-person care to telehealth. So we also should be thinking about how we can be a part of bringing that education and awareness into our community. So thank you so much for highlighting that. So it looks like I have time for one more question. So for Allison, I know you talked about various regulatory changes. So I just wanted to ask, how long will these regulatory changes last for?
That's a million-dollar question. A number of the changes in California have been defined as temporary during the public health emergency. And that's true also at the federal level. Unfortunately, we don't know when the public health emergency will be officially declared over. So long as the public health emergency orders are in place, we can expect that these regulatory changes and the easing of various rules and regulations will continue for the duration of the pandemic. The public health emergency is the kind of classification of authority that allows the federal government and states to issue these changes in an expedited fashion. And COVID-19 is considered a public health emergency. What's going to happen after the public health emergency is eventually declared over? That's anyone's guess, but that's why it is important for us to be doing the planning now. If there are things that we want to see made permanent, we need to start tracking and building a case. So if your organizations are in fact utilizing telehealth, please monitor how well it's being utilized. What's your satisfaction among patients and clients? I don't know if you're asking these questions, but do what you can to collect information and feedback, not only on whether telehealth is effective as a vehicle for delivering healthcare and leads to positive health outcomes, but also what's the satisfaction level among your patients and clients? And for those who may have experienced challenges in the first place with the technology, or maybe they don't have strong Wi-Fi, or they don't have a private place in which to use telehealth, whatever the underlying challenges are, how have you been able to solve those problems? It will be immensely helpful for you if you are tracking those types of issues with some qualitative feedback from your patients, your clients, and also your staff. How are your clinicians, your counselors, your therapists, how are they experiencing telehealth? We've heard that doing the same thing online is a lot more exhausting than doing it in person. And if you have back-to-back virtual meetings on Zoom or whatever your platform is, that can be pretty taxing. And so any learnings that you can share along the way to how to make this easier, how to make this engaging with patients and intimate and comfortable, so that there is that the use of telehealth doesn't in any way disrupt that important trust that is built and cultivated through the course of a patient-provider relationship. How do we ensure that the use of telehealth doesn't in any way derail that trust? So these are all important things to track and consider, so that when the public health emergency ends, we have really good information and can be very thoughtful in what the ask is long term.
Thank you, Allison. I really appreciate your response to that. I know there's a lot of lessons that we have already learned and that we want to continue to learn to make sure that we more effectively are able to respond to health crises and other crises that we may be facing. So I appreciate that. So with that, I would like to thank our esteemed panel for their time and sharing their expertise with us today. We appreciate the amazing work you're all doing around women's health policy issues and identifying opportunities here in Orange County. We really appreciate your work. So with that, thank you again for having me here. And I would like to invite Allison to close out today's summit session.